A 53-year-old male patient has been admitted for evaluation of chest pain. He has been diagnosed with angina and prescribed sublingual nitroglycerin tablets. What important instructions for using this medication should the nurse give the patient? A. Take up to 5 doses at 15-minute intervals after an anginal attack. B. If the tablet does not dissolve quickly, chew the tablet for maximal effect. C. If the chest pain is not relieved, go to hospital immediately. D. Sit or lie down when taking a tablet. Change positions slowly to avoid falling or fainting. Answer. D. Sit or lie down when taking a tablet. Change positions slowly to avoid falling or fainting. Rationale. Sublingual nitroglycerin may cause hypotension. Therefore, after taking a dose, the patient should lie down and move slowly to avoid injury from falling or fainting. 1 tablet should be taken every 5 minutes, up to 3 tablets in 15 minutes. This drug should never be chewed. If chest pain is not relieved, call 911 to activate emergency medical services. Which statement indicates that the patient understands discharge teaching about nitroglycerin? A. I will need to refill my prescription once a year in order to maintain potency. B. I will need to keep the nitroglycerin stored in the bottle it comes in. C. I will take a nitroglycerin tablet every 15 minutes until my chest pain is gone. D. I should take a nitroglycerin tablet 2 hours before I want to engage in activity that will cause chest pain. Answer. B. I will need to keep the nitroglycerin stored in the bottle it comes in. Rationale. Nitroglycerin needs to be stored away from heat, humidity, and light, all of which can decrease its potency. Keeping it in the brown light-resistant bottle helps achieve this. It should be replaced every 3 to 6 months in order to maintain potency. Nitroglycerin is used every 5 minutes for pain relief or just before engaging in activity that is known to cause chest pain. A 74-year-old professional golfer has chest pain that occurs toward the end of his golfing games. He says the pain usually goes away after 1 or 2 sublingual nitroglycerin tablets and rest. What type of angina is he experiencing? A. Classic. B. Variant. C. Unstable. D. Prinzmetals. Answer. A. Classic. Rationale. Classic, or chronic stable, angina is triggered by either exertion or stress and usually subsides within 15 minutes with either rest or drug therapy. A patient with a history of angina will be started on Ranolazine, Ranexa. The nurse is reviewing the patient's history and will note potential contraindications to this drug therapy if which condition is present. Select all that apply. A. Type 2 diabetes mellitus. B. Prolonged QT interval on the electrocardiogram. C. Heart failure. D. Closed angle glaucoma. E. Decreased liver function. Answer. B. Prolonged QT interval on the electrocardiogram. E. Decreased liver function. Rationale. Ranolazine is contraindicated in patients with pre-existing QT prolongation or hepatic impairment. The other options are not contraindications. The nurse is giving intravenous nitroglycerin to a patient who has just been admitted because of an acute myocardial infarction. Which statement is true regarding the administration of the intravenous form of this medication? A. The solution will be slightly colored green or blue. B. The intravenous form is given by bolus injection. C. It can be given in infusions with other medications. D. Non-polyvinyl chloride, non-PVC, plastic intravenous bags and tubing must be used. Answer. D. Non-polyvinyl chloride, non-PVC, plastic intravenous bags and tubing must be used. Rationale. The non-PVC infusion kits are used to avoid absorption and/or uptake of the nitrate by the intravenous tubing and bag and/or decomposition of the nitrate. The medication is given by infusion via an infusion pump and not with other medications. It is not given by bolus injection. If the parenteral solution is discolored blue or green, it should be discarded. A patient arrives in the emergency department with severe chest pain. The patient reports that the pain has been occurring off and on for a week now. Which assessment finding would indicate the need for cautious use of nitrates and nitrites? A. Blood pressure of 88/62 of a millimeter Hg. Apical pulse rate of 110 beats per minute. Circa history of renal disease. D. History of a myocardial infarction 2 years ago. Answer. A. Blood pressure of 88/62 of a millimeter Hg. Rationale. Hypotension is a possible contraindication to the use of nitrates because the medications may cause the blood pressure to decrease. The other options are incorrect. The nurse is providing education about the use of sublingual nitroglycerin tablets. She asks the patient, "What would you do if you experienced chest pain while mowing your yard?" You have your bottle of sublingual nitroglycerin with you. Which actions by the patient are appropriate in this situation? Select all that apply. A. Stop the activity and lie down or sit down. B. Call 911 immediately. C. Call 911 if the pain is not relieved after taking one sublingual tablet. D. Call 911 if the pain is not relieved after taking 3 sublingual tablets in 15 minutes. E. Place a tablet under the tongue. F. Place a tablet in the space between the gum and cheek. G. Take another sublingual tablet if chest pain is not relieved after 5 minutes, up to 3 total. Answer. A. Stop the activity and lie down or sit down. C. Call 911 if the pain is not relieved after taking one sublingual tablet. E. Place a tablet under the tongue. G. Take another sublingual tablet if chest pain is not relieved after 5 minutes, up to 3 total. Rationale. With sublingual forms, the medication is taken at the first sign of chest pain, not delayed until the pain is severe. The patient needs to sit down or lie down and take one sublingual tablet. According to current guidelines, if the chest pain or discomfort is not relieved in 5 minutes, after one dose, the patient, or family member, must call 911 immediately. The patient can take one more tablet while awaiting emergency care and may take a third tablet 5 minutes later, but no more than a total of 3 tablets. These guidelines reflect the fact that angina pain that does not respond to nitroglycerin may indicate a myocardial infarction. The sublingual dose is placed under the tongue, and the patient needs to avoid swallowing until the tablet has dissolved. Placing a tablet between the gum and cheek is the buccal route. What action is often recommended to help reduce tolerance to transdermal nitroglycerin therapy? A. Omit a dose once a week. B. Leave the patch on for 2 days at a time. C. Cut the patch in half for 1 week until the tolerance subsides. D. Remove the patch at bedtime, and then apply a new one in the morning. Answer: D. Remove the patch at bedtime, and then apply a new one in the morning. Rationale: to prevent tolerance, remove the transdermal patch at night for 8 hours. And apply a new patch in the morning. Transdermal patches must never be cut or left on for 2 days, and doses must not be omitted. While assessing a patient who is taking a beta blocker for angina, the nurse knows to monitor for which adverse effect: A. Nervousness. B. Hypertension. C. Bradycardia. D. Dry cough. Answer: C. Bradycardia. Rationale: adverse effects of beta blockers include bradycardia, hypotension, dizziness, lethargy, impotence, and several other effects, but not dry cough or nervousness. A patient has been taking a beta blocker for 4 weeks as part of his antianginal therapy. He also has type 2 diabetes and hyperthyroidism. When discussing possible adverse effects, the nurse will include which information? A. Watch for unusual weight loss. B. Monitor your pulse for increased heart rate. C. Use the hot tub and sauna at the gym as long as time is limited to 15 minutes. D. Monitor your blood glucose levels for possible hypoglycemia or hyperglycemia. Answer: D. Monitor your blood glucose levels for possible hypoglycemia or hyperglycemia. Rationale: beta blockers can cause both hypoglycemia and hyperglycemia. They may also cause weight gain if heart failure is developing, and decreased pulse rate. The use of hot tubs and saunas is not recommended because of the possibility of hypotensive episodes. While assessing a patient with angina who is to start beta blocker therapy, the nurse is aware that the presence of which condition may be a problem if these drugs are used: A. Hypertension. B. Essential tremors. C. Exertional angina. D. Asthma. Answer: D. Asthma. A patient is taking a calcium channel blocker as part of his therapy after a myocardial infarction. What important information or instructions should the nurse give the patient about this medication? A. Chew the tablet for faster release of the medication. B. To increase the effect of the drug, take it with grapefruit juice. C. If the adverse effects of chest pain, fainting, or dyspnea occur, discontinue the medication immediately. D. A high-fiber diet with plenty of fluids will help prevent the constipation that may occur. Answer: D. A high-fiber diet with plenty of fluids will help prevent the constipation that may occur. Rationale: constipation is a common effect of CCBs, and a high-fiber diet and plenty of fluids will help to prevent it. Grapefruit juice decreases the metabolism of CCBs. Extended-release tablets must never be chewed or crushed. These medications should never be discontinued abruptly because of the risk for rebound hypertension. The nurse is reviewing drug interactions with a male patient who has a prescription for isosorbide dinitrate, Iserdal, as treatment for angina symptoms. Which substances listed below could potentially result in a drug interaction? Select all that apply. A. A glass of wine. B. Thyroid replacement hormone. C. Tadalafil, Cialis. An erectile dysfunction drug. D. Metformin, glucophage, an antidiabetic drug. E. Carvedilol, Corig, a beta blocker. Answer: A. A glass of wine. C. Tadalafil, Cialis, an erectile dysfunction drug. E. Carvedilol, Corig, a beta blocker. Which statement by the patient reflects the need for additional patient education about the calcium channel blocker diltiazem, cardizem? A. I can take this drug to stop an attack of angina. B. I understand that food and antacids alter the absorption of this oral drug. C. When the long-acting forms are taken, the drug cannot be crushed. D. This drug may cause my blood pressure to drop, so I need to be careful when getting up. Answer. A. I can take this drug to stop an attack of angina. Rationale. Diltiazem, cardizem, is a calcium channel blocker drug which is prescribed to prevent an angina attack. The absorption of this drug is not affected by the presence of food or antacids when taken orally. The crushing of the drug before oral administration can be done irrespective of the duration of action of the drug. Diltiazem, cardizem, is a drug which does not induce lowered blood pressure as an adverse side effect. A patient has a new prescription for transdermal nitroglycerin patches. The nurse teaches the patient that these patches are most appropriately used for which reason? A. To relieve exertional angina. B. To prevent palpitations. C. To prevent the occurrence of angina. D. To stop an episode of angina. Answer. C. To prevent the occurrence of angina. Rationale. The transdermal antiglycerin patches are useful non-invasive means of delivering the drug into the bloodstream and is used as preventive the occurrence of angina. Transdermal antiglycerin patches are used as preventive measure for angina and not for relieving from exertional angina. Palpitation prevention is not performed by nitroglycerin transdermal patches. These are non-invasive means of delivering the drug to prevent angina. Episodes of angina occur as symptoms after the onset of angina. The transdermal antiglycerin patches help in prevention of angina and not in stopping the episode of angina. Calcium channel blockers reduce myocardial oxygen demand by reducing afterload. How would the nurse explain afterload to the patient? A. It is the blood volume within the heart. B. It is the pressure within the heart. C. It is the pressure against which the heart must pump. D. It is the contractility of the heart muscle. Answer. C. It is the pressure against which the heart must pump. Rationale. Afterload is determined by the pressure in the aorta just before systole. Which statement by the patient demonstrates a need for further education regarding nitroglycerin? A. If I get a headache, I should keep taking my nitroglycerin and use Tylenol for pain relief. B. I should keep my nitroglycerin in a cool, dry place. C. I should change positions slowly to avoid getting dizzy from the nitroglycerin's effect on my blood pressure. D. I can take up to 4 tablets at 5-minute intervals for chest pain. Answer: D. I can take up to 4 tablets at 5-minute intervals for chest pain. Rationale: patients are taught to take up to 3 tablets 5 minutes apart. According to current guidelines, if the chest pain or discomfort is not relieved in 5 minutes, after 1 dose, the patient, or family member, must call 911 immediately. Nitrates relieve angina pain by reducing preload. How would the nurse explain the term preload to a patient? A. It is the blood volume within the heart. B. It is the pressure within the superior vena cava. C. It is the pressure against which the heart must pump. D. It is the oxygen demand of the heart. Answer: A. It is the blood volume within the heart. Rationale: preload is determined by the amount of blood in the ventricle just before contraction. A nurse with adequate knowledge about the administration of intravenous nitroglycerin will recognize that which statement is correct. The intravenous form is given by IV push injection. B. Because the intravenous forms are short-lived, the dosing must be every 2 hours. C. Intravenous nitroglycerin must be protected from exposure to light through use of special tubing. D. Intravenous nitroglycerin can be given via gravity drip infusions. Answer: C. Intravenous nitroglycerin must be protected from exposure to light through use of special tubing. Rationale: the IV form of nitroglycerin solution is sensitive to light and hence should be protected from light using special tubing during administration. The intravenous, IV, administration of nitroglycerin is performed as a gradual process using special tubing. This process should not be performed as an IV push injection. The half-life of the drug nitroglycerin does not change based on the delivery form, transdermal patches, oral or IV. Hence, the dose and frequency of administering nitroglycerin IV depends on the requirement of a particular patient. Intravenous, IV, administration of nitroglycerin is performed by using non-absorptive tubing and not as gravity drip infusions. When titrating intravenous nitroglycerin, which assessment findings does the nurse monitor? Select all that apply. A. Blood pressure. B. Heart rate. C. Chest pain. D. Respiratory rate. E. Temperature. Answer: A. Blood pressure. B. Heart rate. C. Chest pain. Which are common side effects of nitroglycerin? Select all that apply. A. Blurred vision. B. Flushing. C. Headache. D. Hypotension. E. Hypertension. Answer: B. Flushing. C. Headache. D. Hypotension. When caring for a patient with angina, the nurse would question an order for a non-cardioselective beta blocker in a patient with what coexisting medical diagnosis? A. Hypertension. B. Atrial fibrillation. C. Bronchial asthma. D. Myocardial infarction. Answer: C. Bronchial asthma. Rationale: non-cardioselective beta blockers should be used with caution in patients with bronchial asthma since any level of blockade of beta-2 receptors can promote bronchoconstriction through unopposed parasympathetic, vagal, tone. It is most important to instruct a patient prescribed nitroglycerin to avoid which substances? A. Antacids. B. Grapefruit juice. C. Thiazide diuretics. D. Erectile dysfunction medications. Answer: D. Erectile dysfunction medications. Rationale: concurrent administration of erectile dysfunction medications such as sildenafil citrate, Viagra, can cause an acute exacerbation of nitrate-related hypotension. A patient receiving intravenous nitroglycerin at 20 mcg per minute complains of dizziness. Nursing assessment reveals a blood pressure of 85/40ths of a millimeter Hg, heart rate of 110 beats per minute, and respiratory rate of 16 breaths per minute. What is the nurse's best action? A. Assess the patient's lung sounds. B. Decrease the intravenous nitroglycerin by 10 mcg per minute. C. Increase the intravenous nitroglycerin by 10 mcg per minute. D. Recheck the patient's vital signs in 1 hour. Answer. B. Decrease the intravenous nitroglycerin by 10 mcg per minute. Rationale. Nitroglycerin, as a vasodilator, causes a decrease in blood pressure. Because it is short-acting, decreasing the infusion rate will allow the blood pressure to rise. The patient should be monitored every 10 minutes while changing the rate of the intravenous nitroglycerin infusion. When applying nitroglycerin ointment, the nurse should perform which action? A. Use the fingers to spread the ointment evenly over a 3-inch area. B. Apply the ointment to a non-hairy part of the upper torso. C. Massage the ointment into the skin. D. Apply 2 thick lines of ointment over the prescribed measured area on the nitroglycerin paper. Answer. B. Apply the ointment to a non-hairy part of the upper torso. Rationale. Absorption is best over a non-hairy portion of skin. The upper torso is the preferred site of application. The nurse should wear gloves when applying to prevent transdermal absorption by the applier. The ointment is measured as one straight line on the nitroglycerin patch and is gently spread over paper and applied, but not rubbed, into the skin. Rubbing would absorption and risks of side effects. A patient who is taking sublingual nitroglycerin is complaining of flushing and headaches. What is the nurse's best response? A. This is a normal response to your chest pain. B. Stop taking the nitroglycerin because you are probably allergic to it. C. These are the most common side effects of nitroglycerin. They should subside with continued use of nitroglycerin. D. These symptoms are not related to your sublingual nitroglycerin. You should notify your doctor for diagnostic testing. Answer. C. These are the most common side effects of nitroglycerin. They should subside with continued use of nitroglycerin. Rationale. Headache and flushing are the most common side effects of nitroglycerin and will subside with continued use. In order to prevent the development of tolerance, the nurse instructs the patient to perform which action? A. Apply the nitroglycerin patch every other day. B. Switch to sublingual nitroglycerin when the patient's systolic blood pressure elevates to greater than 140 mm Hg. C. Apply the nitroglycerin patch for 16 hours each and remove for 8 hours at night. D. Use the nitroglycerin patch for acute episodes of angina only. Answer. C. Apply the nitroglycerin patch for 16 hours each and remove for 8 hours at night. Rationale. Tolerance can be prevented by maintaining an 8-hour nitrate-free period each day. Patient teaching regarding sublingual nitroglycerin should include which statement? A. You can take up to 5 doses every 3 minutes for chest pain. B. Chew the tablet for the quickest effect. C. Keep the tablets locked in a safe place until you need them. D. Sit or lie down after you take a nitroglycerin tablet to prevent dizziness. Answer. D. Sit or lie down after you take a nitroglycerin tablet to prevent dizziness. Rationale. Nitroglycerin is a vasodilator and can cause orthostatic hypotension, resulting in dizziness. It should be kept in a readily accessible location for immediate use should chest pain occur. 3 tablets may be taken 5 minutes apart. It should be placed under the tongue and allowed to dissolve. The patient asks how nitroglycerin should be stored while traveling. What is the nurse's best response? A. You can protect it from heat by placing the bottle in an ice chest. B. It's best to keep it in its original container away from heat and light. C. You can put a few tablets in a resealable bag and carry in your pocket. D. It's best to lock them in the glove compartment of your car to keep them away from heat and light. Answer. B. It's best to keep it in its original container away from heat and light. Rationale. Although nitroglycerin needs to be kept in a cool, dry place, it should not be placed in an ice chest where it could freeze. It should also not be locked up and needs to be kept away from light, not in a clear plastic bag. What is included in the priority assessment before administering isosorbide mononitrate, IMTR? A. Serum electrolytes B. Blood urea nitrogen, BUN, and creatinine C. Blood pressure D. Level of consciousness. Answer. C. Blood pressure. Rationale. Mononitrate is a vasodilator and thus can cause hypotension. It is important to assess blood pressure before administering. Which nitrate preparation or dosage form has the longest duration of action? A. Sublingual nitroglycerin B. Sublingual isosorbide dinitrate C. Oral isosorbide dinitrate D. Transdermal nitroglycerin patch. Answer. D. Transdermal nitroglycerin patch. Rationale. The transdermal patch has an 8 to 12 hour duration of action, compared with 0.5 to 6 hours for the other choices. Which signaling mechanism participates in the vasodilative effect of nitroglycerin? A. Activation of nitric oxide synthase B, inhibition of phosphodiesterase C, inhibition of intracellular calcium release D, activation of guanylate cyclase E, activation of adenylate cyclase. Answer. D. Activation of guanylate cyclase. Which drug reduces heart rate and increases coronary blood flow? A. Isosorbide mononitrate B, atenolol C, verapamil D, ranolazine E, felodipine. Answer. C. Verapamil. A patient is given a drug that decreases anginal episodes without reducing heart rate or blood pressure. Which mechanism is responsible for the beneficial effects of this drug? The increased utilization of glucose by the heart B, improved cardiac diastolic function C, inhibition of fatty acid oxidation in the heart D, increased sodium influx into myocytes E, increased calcium influx into myocytes. Answer. B. Improved cardiac diastolic function. A 68-year-old man has been taking the nitrate isosorbide dinitrate, Iserdal, for 2 years for angina. He recently has been experiencing erectile dysfunction and wants a prescription for sildenafil, Viagra. Which response would the nurse most likely hear from the prescriber? He will have to be switched to isosorbide mononitrate if he wants to take sildenafil. B. Taking sildenafil with the nitrate may result in severe hypotension. So a contraindication exists. C. I'll write a prescription, but if he uses it, he needs to stop taking the isosorbide for one dose. D. These drugs are compatible with each other. And so I'll write a prescription. Answer. B. Taking sildenafil with the nitrate may result in severe hypotension, so a contraindication exists. Eva has been using a certain class 1A antiarrhythmic drug for a very long time. However, over the past few weeks, Eva has lost a lot of weight and has been experiencing severe episodes of nausea and diarrhea. She has also developed a scaly red skin rash. She visits Dr. Redford's clinic for a consultation. Dr. Redford studies her electrocardiogram, ECG, and notices that the durations of the PR, QRS, and QT waves in Eva's heart are much longer than usual. He advises Eva to stop taking the drug. Which of the following drugs has Eva most likely been using? A. Propranolol, B. Procainamide, C. Sotalol, D. Amiodarone. Answer. B. Procainamide. What is the primary mechanism of action of both nitrate drugs and drugs used to treat erectile dysfunction? A. Increasing the formation of nitric oxide. B. Inhibiting a phosphodiesterase enzyme. C. Increasing the presence of nitrate ions in the blood. D. Relaxing skeletal muscle and causing vasoconstriction. Answer. A. Increasing the formation of nitric oxide. Vincent, a 35-year-old man, is prescribed Nitrogard to prevent anginal attacks. Which of the following drugs is contraindicated in this scenario? A. Sildenafil. B. Verapamil. C. Nadolol. D. Atenolol. Answer. A. Sildenafil. Malia, a 45-year-old architect, is prone to angina attacks. Which of the following forms of nitroglycerin should Malia use to prevent angina attacks? A. Nitroglycerin spray. B. Nitroglycerin for IV infusion. C. Nitroglycerin extended-release capsules. D. Nitroglycerin tablets administered sublingually. Answer. C. Nitroglycerin extended-release capsules. Which of the following is an important therapeutic effect achieved by nitrates in the treatment of angina? A. Decrease in cardiac work. B. Increase in preload. C. Increase in afterload. D. Decrease in clot formation. Answer. A decrease in cardiac work. Which of the following explains the inability of the nitrates to act as coronary dilators during angina? A. Arteriolar dilation is greater than vasodilation as at low-dose ranges. B. Nitrates do not act on vascular smooth muscle. C. The most common route of administration is sublingual. D. The arteries are already maximally dilated by ischemia. Answer. D. The arteries are already maximally dilated by ischemia. David is diagnosed with unstable angina. What is the preferred therapy for this form of angina? A. Administering antianginal, anticoagulant, and antiplatelet drugs. B. Resting and reducing all physical activities. C. Using nitrates in combination with tadalafil and vardenafil. D. Administering a high dose of calcium channel blockers such as nifedipine and nicardipine. Answer: A. Administering antianginal, anticoagulant, and antiplatelet drugs. Identify a true statement about variant or prinzmetal angina. A. This type of angina occurs with advanced coronary artery disease. B. This type of angina is caused by progressive blockade of the coronary arteries by blood clots. C. This type of angina is unpredictable and can occur at any time, even during sleep. D. This type of angina is brought on by exercise, overexertion, or stress. Answer: C. This type of angina is unpredictable and can occur at any time, even during sleep. Which of the following is an adverse effect that does not likely result from an overdose of the calcium channel blocker verapamil? A. Bradycardia. B. Decreased myocardial contraction. C. Increased myocardial contraction. DAV block. Answer: C. Increased myocardial contraction. Identify a non-pharmacologic treatment that a patient should consider to prevent the progression of angina attacks. A. Exercise and a low-fat diet. B. Smoking cessation. C. Weight control. D. All of the above. Answer: D. All of the above. Select the available strengths of the sublingual nitroglycerin tablet Nitrostat. A. 2.5, 5, and 10 mg sublingual tablets. B. 0.3, 0.4, and 0.6 mg sublingual tablets. C. 40 mg CR tablets and capsules. D. 1, 2, and 3 mg extended release buccal tablets. Answer: B. 0.3, 0.4, and 0.6 mg sublingual tablets. The excessive prolongation of the QT interval by antiarrhythmic drugs can lead to all of the following except: A. Hypoglycemia. B. Hypotension. C. Fainting. D. Ventricular arrhythmias. Answer: A. Hypoglycemia. Which of the following statements is true of antiarrhythmic drugs? A. Antiarrhythmic drugs that decrease the duration of phase 0 of the cardiac action potential are the most effective therapeutically. B. Most antiarrhythmic drugs exert their major antiarrhythmic action on a specific phase of the action potential. C. Very few antiarrhythmic drugs have the potential to make any existing arrhythmia worse. D. Antiarrhythmic drugs that reduce the durations of phases 1 and 3 of the cardiac action potential produce effective antiarrhythmic actions. Answer: B. Most antiarrhythmic drugs exert their major antiarrhythmic action on a specific phase of the action potential. Rationale: Antiarrhythmic drugs produce effective antiarrhythmic actions by slowing phase 0, prolonging phases 1 and 3, decreasing phase 4 automaticity. What happens during phase 4 of the cardiac action potential? A. Potassium ions efflux out of the cardiac membrane as it undergoes repolarization. B. Sodium ions enter the cardiac membrane as it undergoes depolarization. C. The membrane potential returns to its resting level and prepares itself for the next action potential. D. Calcium channels open and calcium ions pass into muscle cells. Answer: C. The membrane potential returns to its resting level and prepares itself for the next action potential. Rationale: During phase 2 of the cardiac action potential, calcium ions move into the muscle cells. Calcium ions plays a major role in bringing about myocardial contraction during phase 2 of the cardiac action potential. Which of the following is an example of a life-threatening arrhythmia caused by electrical conduction disturbances? A. Atrial fibrillation. B. Ventricular fibrillation. C. Ectopic foci. D. Premature ventricular contraction. Answer: B. Ventricular fibrillation. What type of pattern would one expect the P waves of the electrocardiogram, ECG, of a person with atrial flutter to have? A. A sawtooth pattern. B. A pattern resembling a bag of worms. C. A pattern in which the P waves are clubbed together in triplets. D. An inverted pattern. Answer: A. A sawtooth pattern. Counting the number of QRS waves in an electrocardiogram, ECG, that occur within a 1-minute period helps determine the blank. A. Cardiac output. B. Heart rate. C. Stroke volume. D. Number of premature atrial contractions. Answer: B. Heart rate. Ectopic foci are often caused due to A. An increase in the activity of the sinoatrial (SAW) node. B. An increase in the activity of the atrioventricular (AV) node. C. A delay or blockage in the conduction of electrical impulses. D. A decrease in the number of cholinergic neurons innervating the heart. Answer: C. A delay or blockage in the conduction of electrical impulses. Antiarrhythmic drugs primarily affect the activity of all of the following ions except A. Chlorine ions. B. Sodium ions. C. Potassium ions. D. Calcium ions. Answer: A. Chlorine ions. Rationale: the clinical management of arrhythmias involves the use of antiarrhythmic drugs that primarily affect the activity of sodium, Na, potassium, K, and calcium, Ca, ions. In the context of supraventricular arrhythmias, which of the following is true of atrial flutter? A. The atrial rate of a person with atrial flutter is between 150 and 200 beats per minute. B. The ventricles of a person with atrial flutter contract at a slower rate. C. In a person with atrial flutter, there are no effective atrial contractions. D. The electrocardiogram of a person with atrial flutter will show larger, more interspaced P waves. Answer: B. The ventricles of a person with atrial flutter contract at a slower rate. Rationale: in atrial flutter, the atrial rate is between 250 and 350 beats per minute. Instead of normal P waves, the electrocardiogram, ECG, shows smaller waves with a sawtooth-like pattern. The ventricles cannot keep up with the atria and contract at a slower rate. The duration of the PR interval on an electrocardiogram, ECG, reflects the time required for A. Depolarization and conduction through the ventricles. B. Conduction from the sinoatrial, SAW, to the atrioventricular, AV, node. C. Depolarization and repolarization of the ventricles. D. Conduction from the atrioventricular, AV, node to the sinoatrial, SAW, node. Answer: B. Conduction from the sinoatrial, SAW, to the atrioventricular, AV, node. Rationale: in the context of monitoring electrocardiography, The duration of the PR interval reflects the time required for conduction from the SAW to the AV node. Which of the following drugs is preferred for the treatment of supraventricular tachycardia? A. Verapamil B. Atropine C. Amiodarone D. Lidocaine. Answer. A. Verapamil. Rationale. Supraventricular tachycardia refers to a type of arrhythmia that originates in the sinoatrial SAW node and causes a sustained increased heart rate of over 100 beats per minute. Atropine is used to treat sinus bradycardia because it increases all of the following except A. Heart rate B. AV conduction C. Blood pressure D. SAW conduction. Answer. D. SAW conduction. All of these drugs slow atrioventricular AV conduction to protect the ventricles in atrial fibrillation except A. Beta blockers B. Atropine C. Calcium channel blockers D. Digoxin. Answer. B. Atropine. In the context of calcium channel blockers, how do dihydropyridines differ from non-dihydropyridines? A. Unlike dihydropyridines, non-dihydropyridines increase heart rate and AV conduction. B. Unlike non-dihydropyridines, dihydropyridines do not have direct antiarrhythmic effects on the heart. C. Unlike dihydropyridines, non-dihydropyridines are not arterial vasodilators. D. Unlike non-dihydropyridines, dihydropyridines are widely used for their antiarrhythmic effects. Answer. B. Unlike non-dihydropyridines, dihydropyridines do not have direct antiarrhythmic effects on the heart. What is the primary mechanism of action of class 4 antiarrhythmic drugs? A. They block sodium channels. B. They block adrenergic beta-1 receptors. C. They block calcium channels in the sinoatrial SAW and atrioventricular AV nodes. D. They block potassium channels. Answer. C. They block calcium channels in the sinoatrial SAW and atrioventricular AV nodes. Rationale. Calcium channel blockers affect the sinoatrial SAW node by slowing depolarization and decreasing the heart rate. Calcium channel blockers reduce myocardial contractility. Mia is rushed to the hospital after taking an overdose of a certain antiarrhythmic drug. On examining her condition, the doctors note that she has a blockage in her heart, corneal microdeposits, and a distinct blue-gray skin discoloration. Dr. Ross, the doctor in charge, immediately recognizes these adverse effects as those caused by a certain potassium channel blocker. Based on this information, which of the following drugs might Mia have ingested? A. Esmolol B. Amiodarone C. Adenosine D. Atropine. Answer. B. Amiodarone. A difference between dofetilide and ibutylide is that a dofetilide acts by blocking sodium channels, whereas ibutylide acts by blocking potassium channels. B. Dofetilide is administered orally, whereas ibutylide is administered intravenously. C. Dofetilide is indicated for the treatment of atrial flutters, whereas ibutylide is indicated for the treatment of atrial fibrillation. D. Dofetilide is a class 2 antiarrhythmic drug, whereas ibutylide is a class 4 antiarrhythmic drug. Answer. B. Dofetilide is administered orally, whereas ibutylide is administered intravenously. Class 3 antiarrhythmic drugs work by blocking the adrenergic beta-1 receptors. B. Influx of calcium ions during phase 2 of the cardiac potential. C. Influx of sodium ions during the depolarization phase. D. Efflux of potassium ions during the repolarization phase. Answer: D. Efflux of potassium ions during the repolarization phase. Which of the following is true of Class 2 antiarrhythmic drugs? A. They tend to shorten the cardiac refractory period. B. They increase the excitability, conduction, and automaticity of ventricular muscle. C. They decrease heart rate, atrioventricular, AV, conduction, and automaticity of the sinoatrial, SAW, and AV nodes. D. They are mainly indicated for arrhythmias that originate below the AV node. Answer: C. They decrease heart rate, atrioventricular, AV, conduction, and automaticity of the sinoatrial, SAW, and AV nodes. A potentially fatal problem that can occur with the use of amiodarone is A. Malignant hyperthermia. B. Tachycardia. C. Pulmonary fibrosis. D. Constipation. Answer: C. Pulmonary fibrosis. Dr. Cooper notices some irregularities in Alex's heartbeat. After a thorough examination, he diagnoses Alex with ventricular arrhythmia. Dr. Cooper advises Alex to start taking a Class 1A antiarrhythmic drug in an extended-release tablet form once every 12 hours. On being asked about the drug's mechanism of action by an assistant, Drive, Cooper states that the drug slows conduction in the heart and prolongs the cardiac refractory period. Based on the information provided in this scenario, which of the following drugs has Drive? Cooper most likely prescribed? A. Sotalol. B. Amiodarone. C. Esmolol. D. Procainamide. Answer: D. Procainamide. What is an adverse syndrome produced by quinidine in overdosage or in patients who are sensitive to the drug? A. Hypertension. B. Tachypnea. C. Synchonism. D. Dry mouth. Answer: C. Synchonism. Samuel is prescribed sublingual nitroglycerin to treat angina pain. How long will it take for nitroglycerin to take effect? A. 1 to 3 minutes. B. 3 to 5 minutes. C. 5 to 7 minutes. D. 2 to 4 minutes. Answer: A. 1 to 3 minutes. The type of angina that is characterized by vasospasm is blank. A. Stable angina. B. Prinzmetal angina. C. Ischemia. D. Exertional angina. Answer: B. Prinzmetal angina. Rationale: vasospasm is the major feature of variant or Prinzmetal angina. Identify the term that refers to the reduction in blood flow caused by atherosclerosis. A. Tachycardia. B. Variant angina. C. Ischemia. D. Exertional angina. Answer: C. Ischemia. Rationale: the reduction in coronary blood flow caused by atherosclerosis is referred to as ischemia. Will, a 38-year-old man, is prone to anginal attacks. Will's doctor prescribes a combination of drugs for long-term as well as short-term management of angina. Which of the following is the most likely combination of drugs prescribed by Will's doctor? A. Diltiazem and tadalafil B. Metoprolol and verapamil C. Propranolol and atenolol D. Nadolol and isosorbide dinitrate. Answer: D. Nadolol and isosorbide dinitrate.